After giving birth to my first son, I found out I had diastasis recti. I worked on it and lost the weight, but now, after 3 kids, this is what my stomach looks like. So let's go to the hospital and find out more about diastasis recti. Are there causes of diastasis recti, or it just chooses anybody that it likes?
Diastasis recti, you're looking at when you have a laxity of that strong connective tissue. People sometimes confuse with abdominal hernias. Now, but in diastasis recti, you don't have a defect. It's more or less like it's lax. So just imagine like a loose tissue that something is just pushing on it. So if it pushes on it, you see that bulge, right? Now, when we are talking about the cause of diastasis recti, it actually doesn't only affect women, it affects both genders, but there's higher prevalence in women because at one time in your reproductive cycle you need to give birth, right? For the causes, anything that increases your intra-abdominal pressures, so let's say you become pregnant, right? What happens is that your abdomen is now having an extra load, okay? So you realize that your abdomen will now have to like bulge out, to enable to accommodate what is inside your uterus. Anything that's just going to increase your intra-abdominal size or intra-abdominal girth and intra-abdominal mass basically will just predispose you to diastasis recti.
For CS moms or people who are willing to have like elective C-section, is it possible to repair diastasis recti during their surgery?
You have the conservative way, right, where you allow the body to heal on its own. Then we have the non-surgical approaches. We have the physiotherapy, the core strengthening exercises. For the surgical approach, you have like an open abdomen, so where you open the abdomen and fix it, or you have like laparoscopic, where like you poke holes into the abdomen and put some tools in there. That one is minimally invasive. Yes, it can be done intra, but most often than not, the number of factors that determine what you do in the surgery, you get to, let's say if during the C-section the patient is losing like a lot of blood, like you want to hurry up and secure hemostasis. Cosmesis can always come later.
Is there any risk attached to just leaving diastasis recti to be like, is there any risk attached to just leaving it like that?
So what happens is that you can have like some lumbo-pelvic pain, you get it, and sometimes you can even have stress incontinence, you get it. So like you can have like urine leaking.
There are times when I eat and I can literally see a bulge. So when I lie down, it literally looks like my stomach has come up.
Yeah, so I mean this a defect, you can come and feel it. You get, so you can see these tense muscles. These are your 6-pack muscles. You get it. So you can feel that there's a defect over here. So you see when she was laughing, you could see this, you can see the bulge coming out. So
if you're a mom in Nigeria or Ghana and you're wondering if you have any of these postpartum complications, you can come to Sinel Specialist Hospital and talk to our handsome Dr. Manahini.